everybody, it's Dr. Magda Bacot from JRSVetandPobly.com. This is Bama Button. She's a middle-aged, indoor, mildly outdoor cat. This lesion on her thorax, so this is her chest, appeared a couple months ago. He said it was very small, like the size of a button. It has subsequently grown into this. She was licking all around because, of course, it's bothering her. At this point, it absolutely has to come off. There's no other way to treat this. This is some sort of cancerous lesion, and it's not going to go away on its own. It's not going to be responsive to treatment, and it's got to come off. He unfortunately went to lots of vets to get opinions. They gave him estimates in the $800 to $1,000 range, which ideally is what this should be, but he's on a very tight budget, so we're going to do it for a couple $100 for him. It means we have to do things like decline pre-op anesthetic blood work, pre-op radiographs, which we really should do if this is a cancerous lesion, and then he can't send in for biopsy, which is about $200. So we're going to shave probably $400 to $600 off of the price of this just by taking it off, getting this cat some relief, because clearly she can't live like this. Another thing to mention is she was spayed later in life, so she had 2 previous litters. Certainly mammary cancers are more likely if they have been spayed later. At least that's what I found. I'm not quite sure this is a mammary tumor. You can see her nipples, and there's a nipple missing here, so there's a chance it could be. Typically in cats, mammary tumors are pretty aggressive, which is why we always want a biopsy. But in cases like this, if we don't get this lesion off of this cat, she can't live like this. It's going to start to ulcerate and bleed, and then it's going to be a chronic non-healing wound, and she will die of that just because it's something you can't manage. So if you have a cat or a dog that's got some lesion that you're concerned about and it's growing rapidly, this grew over a couple of months, please go see your vet. If you are on a really tight budget, ask them about what diagnostics you can opt out of. It means that you assume more of the responsibility. It also means that we won't have as many answers should this come back, but it's going to save the life of your cat. There's a very good chance that this will come off and never come back, but if we left it on, she would be euthanized within the next couple of months because you can't manage this. If you have any questions, you can find me at Pobly.com or come visit me at Jarrettsville Vet. Take care, everyone. Bye.